Hello everyone, my name is Lisa Akhtar. I'm presenting Caring for Clients with Chronic Needs. This presentation focuses on comprehensive care for clients with chronic needs, highlighting evidence-based intervention across primary care, community support, post-acute care, and palliative strategies. The aim is to improve health outcomes, promote patient autonomy, and ensure coordinated family-centered care. We will explore models such as chronic care model and patient-centered medical home, discuss best practice in self-management, social support, and adherence, and review system level and policy considerations. References are included for credibility. Objectives. By the end of this presentation, nurse should be able to describe how chronic illness affect physical, mental, and social functioning. Learners will explore evidence-based care model like chronic care model, integrate family and community support into care planning, and implement primary, post-acute, and palliative care interventions. Additionally, participants will understand the role of health policy in shaping chronic care outcomes. This objective guide the presentation to promote comprehensive and patient-centered nursing strategies. Tell a little bit about myself. My name is Lisa Akhtar. I'm a registered nurse with experience in acute and chronic care management. My background includes caring for a patient with chronic respiratory, cardiovascular, and neurological conditions. I'm particularly interested in improving care coordination, family engagement, and the integration of complementary therapies. This presentation reflects my commitment to evidence-based practice and lifelong learning. My goal is to share practical strategies and insights that enhances quality of life for clients and empower nurses to implement holistic patient-centered care approaches. Illness experience. Chronic illnesses affect clients beyond physical symptoms, including mental health, emotional well-being, and social participation. Nurses must recognize hidden challenges like fatigue, pain, and stigma. Effective assessment include evaluating physical limitation, psychological stressor, and family dynamics. By understanding the illness experience holistically, nurse can tailor intervention to promote coping, adherence, and quality of life. Recognizing the multi-demonstration impact ensure the care plans address the complete need of clients with chronic conditions. Social isolation. Social isolation is a lack of meaningful social interactions, which can negatively affect health outcomes. Risk factors include age, mobility limitations, chronic illness, and living alone. Best practices include structured social programs, peer support groups, and technology assisted communication. Nurses can educate families about fostering engagement and encouraging participation in community activities. For a 7-year-old client with hemophilia, providing opportunity for safe social interaction and family support enhances emotional well-being and reduces isolation. Health-related quality of life. Health-related quality of life encompasses physical, emotional, and social dimensions affected by chronic conditions. Nurses can support health-related quality of life by promoting symptoms management, physical rehabilitation, counseling, and social engagement. Interventions may include a structured exercise program, stress management, and family education. For a 60-year-old client post-stroke, nurses reinforce rehabilitation exercise, provide education on adapting strategies, and facilitate family involvement. Understanding health-related quality of life helps nurses prioritize interventions that improve overall patient satisfaction and daily functioning. Powerlessness. Powerlessness occurs when clients perceive little control over their health outcomes. Chronic illnesses, limited mobility, or dependency may contribute. Nurses assess powerlessness through observation, client feedback, and psychological evaluation. Interventions include collaborative care planning, goal setting, and empowerment strategies. Educating the client and family on self-management options foster autonomy. For a 20 years old with schizophrenia, nurses encourage participation in treatment discussions, providing coping strategies, and facilitate support networks, enhancing both engagement and self-efficacy. Intimacy. Intimacy refers to close personal relationships and emotional connectedness. Chronic illness may challenge intimacy due to physical limitation, fatigue, or social stigma. Nurses can facilitate communication skills, couple counseling, and support groups. Education includes discussing sexual health, emotional need, and adaptive strategies. For a 30-year-old with new paralysis, nurses help address body image concerns, support partner communication, and provide resources for adaptive intimacy. Ensure, to ensure that personal relationships are maintained and enhanced despite chronic conditions. Coping. Coping is the process of managing stressors and adapting to life changes. Chronic illnesses can challenge coping abilities, leading to maladaptive behavior. Nurses assess coping through patient interviews, observation, and psychological screening. Interventions include cognitive behavioral strategies, relaxation technique, and social support. Educating clients and families on effective coping enhances reliance. For a 54-year-old with bipolar disorder, nurses provide structured coping plans, emotional support, and crisis management strategies to improve daily functioning and adherence to treatment. Self-management. Self-management empowers clients to take active control of their chronic condition, including medication adherence, lifestyle modification, and symptom monitoring. Nurses provide education, skills training, and regular follow-up. Monitoring adherence ensures treatment effectiveness and prevents complications. For a 12 years old with type 1 diabetes, nurses teach insulin administration, blood glucose monitoring, nutrition, and physical activity strategies. Family involvement is also necessary. Effective self-management improves outcome, reduce hospitalization, and enhance the client's condition and autonomy in managing their health. Spirituality. Spirituality relates to meaning, purpose, and connectedness distinct from formal religion. Chronic illness may prompt existential concerns. Nurses assess spiritual needs through discussion and observation. Intervention include counseling, medication, and referral to chaplaincy services. Educating clients and families on spiritual resources enhances coping and emotional well-being. For an 85 years old arthritis, nurses facilitate reflection, prayer, and meditation, promoting resilience, hope, and comfort. Incorporating spirituality into care supports holistic well-being and reinforcement in patient-centered approaches. Client and family education. Client and family education ensures understanding of disease, treatment, and self-care. Nurses use verbal instruction, demonstration, written material, and technology-assisted learning. Assessing literacy and readiness is essential for effective teaching. Reinforcement through follow-up and return demonstration improves retention. Collaboration with family support, adherence, and emotional support. For an 8-year-old asthma, Nurses educate caregivers on inhaler use, trigger evidence, and emergency action plan, promoting safety, independence, and confidence in managing chronic condition at home. Social support. Social support refers to the emotional, informational, and practical assistance individuals receive from family, friend, and community. For clients with chronic illness, especially adolescents with depression, social connections are essential to recovery and adherence. Nurses can help families identify local mental health resources, encourage participation in peer group, and teach effective communication strategies. Intervention should promote consistent emotional reinforcement and reduce isolation. By strengthening family involvement and community connection, nurses enhance the client's coping capacity and long-term reliance. Adherence. Adherence refers to how well clients follow up prescribed treatments, including medication, therapy, and lifestyle changes. Barriers include cost of forgetfulness, side effects, cultural beliefs, and lack of understanding. Nurses play a crucial role by educating clients, reinforcing the importance of adherence, providing reminders, and creating individualized care plans. Promoting adherence reduces complications, improve health outcome, and enhances the quality of life. For example, a 21-year-old client with obesity may need structured education on diet and exercise routine. Culture and health disparities. Culture encompasses the shared beliefs, values, and practices of individuals or groups, influencing health behaviors and perceptions. Health disparities are differences in outcomes related to race, ethnicity, socioeconomic status, or access to care. Nurses can reduce disparities through culturally competent communication, patient-centered care, and advocacy. For a 27-year-old Black client with sickle cell anemia, nurses should incorporate culturally sensitive education, addresses barriers to care, and promote support resources. Awareness improves adherence, engagement, and outcomes. Family caregiving. Family caregivers play a vital role in managing chronic illness, but they are at risk of physical, emotional, and financial burnout. Nurses can educate caregivers on time management, stress reduction, and available resources like respite care. For a caregiver working part-time with three children, including one with autism, nurses should provide guidance on structured routine, support groups, and community services. Reinforcing practical strategies ensure both caregiver well-being and effective client care, ultimately improving family reliance and patient outcomes. Models of care. The chronic care model emphasizes proactive team-based care to provide outcome for chronic illness. Family-centered care ensures involvement of loved one in care planning. Medicaid provides coverage for older adults and certain disability, while Medicaid supports low-income individuals with broader long-term care services. For a 50 years old with COPD, services may include pulmonary rehab, medication support, and home health visits. Nurses coordinate care, educate client, and establish with interdisciplinary team to optimize health outcomes and adherence. Primary care. Primary care provides first contact, continuous, and comprehensive care. Best practices include regular assessment, chronic disease management, and patient education. The patient care medical home model emphasizes coordinated team-based care and long-term relationships. For a 45-year-old client with recurrent cancer, nurses facilitate symptom management, monitor treatment response, coordinate with specialists, and ensure follow-up appointments. Encouraging patient engagement and self-management improves outcome, reduce hospitalization, and enhance quality of life for chronic illness clients. Community care. The social ecological model considers individual, interpersonal, organizational, and community factors affecting health. Community care includes support groups, exercise programs, nutrition workshops, and home health services. For a 75-year-old with Alzheimer's disease, nurses can recommend memory care programs, caregiver support, and safety interventions. Collaboration with local agencies ensure access to resources and social engagement. Community level interventions reduce isolation, enhance well-being, and complement primary and post-acute care. Post-acute care. Post-acute care supports patients transitioning from hospital to home, focusing on minimizing readmission and promoting recovery. Services include home health visits, rehabilitation, and telehealth. Nurses provide education on medications, symptom monitoring, and self-care strategies. For a 16-year-old with cystic fibrosis, interventions may include pulmonary therapy guidance, nutrition counseling, and infection prevention. Effective post-acute care ensures continuity, reduces complications, and empowers families to manage chronic condition at home. Palliative care. Palliative care aims to relieve symptoms and improve quality of life for clients with serious illnesses. It is not limited to end of life care, unlike hospice. Nurses assess pain, provide emotional support, and coordinate care among interdisciplinary team. For a 90-year-old with the incurable cancer expected to live over 6 months, intervention include pain management, counseling, and family education. Palliative care enhances patients' autonomy, comfort, and satisfaction while addressing psychosocial and spiritual needs. Complementary and integrative health. Complementary and integrative health includes therapies such as herbal medicine, acupuncture, meditation, and yoga. Nurses must educate patients about safe integration with conventional treatments, potential interaction, and evidence-based benefits. For a 52-year-old with ALS interested in herbal therapy, education should include doses, potential side effects, and coordination with the physician. Integrative approaches support symptom management, improve quality of life, and empower clients to actively participate in their care. Health policy. Health policies shape access, quality, and outcome in chronic care. Nurses must understand financing, workforce regulations, and scope of practice roles. Stakeholders include government agencies, healthcare organizations, advocacy groups, and patients. Policies supporting interdisciplinary team, value-based care, and patient-centered medical home improve chronic illness management. Nurses can advocate for change, implement evidence-based policies, and educate clients on their rights and resources. Effective policy engagement ensures sustainable, high quality care for individuals and families managing chronic conditions. In summary, chronic care requires a structured, multi level approach involving patients, family, and healthcare teams. Effective management combines primary, post-acute, and community care supported by evidence-based intervention and complementary therapies. Nurses play a crucial role in patient education, care coordination, and policy advocacy. Their engagement ensures adherence, improves quality of life, and reduces healthcare disparities. Recognizing the complexity of chronic illness empowers clinicians to provide holistic, patient centered care for optimal outcomes. Thank you for listening my presentation.